Hi, everyone. Thank you for your interest in the Health Resources and Services Administration's fiscal year 2023 Early Childhood Development Competitive Funding Opportunity. For the rest of today's presentation, we will refer to this funding opportunity as ECD. My name is Yedidia Amaha, and I'm presenting with my colleague, Emily Leonard. We are members of the ECD Technical Assistance Team in HRSA's Bureau of Primary Healthcare. This presentation will provide you with helpful information to complete your application. At the end of this presentation, we'll provide you with information on how to contact the team if you have questions while developing your application. A question and answer session will follow today's presentation. You may submit your questions through the Q&A pod at any time during the presentation. In this presentation, we'll provide an overview of the ECD funding opportunity, highlight important considerations and reporting requirements, review technical assistance resources that may be helpful to you as you develop your project, and end by answering your questions. And now I'm pleased to turn things over to Captain Jaewon Hong, a member of BIPIC's Office of Health Center Investments Oversight Clinical Team, to share a bit about why it is so important for health centers to engage in this effort.
Thank you very much for the introduction. As the slide notes, the early years are a critical time for identifying any delays in child development. Children who do not follow the expected social emotional development path may experience undetected mental and emotional health problems. Unfortunately, many children with developmental disabilities are not identified until they're in school, resulting in missed opportunities for early intervention and treatment. There is a great need for developmental screening. Less than 37% of young children receive a recommended screening from a healthcare provider. And as you see in the statistics presented here, there are disparities in access to developmental screenings and services. One study found that babies from middle or high income backgrounds were 26% more likely to have a developmental screening than babies from low income backgrounds. The key to long-term success for kids with delays and disabilities is early intervention services. And with health centers serving over 2.8 million children from ages 0 to 5, this represents a key opportunity for ECD screening and related services.
Thank you for that helpful background. We'll now provide an overview of the ECD funding opportunity. The purpose of ECD funding is to improve developmental outcomes among children served by health centers. Health centers will accomplish this by increasing the number of developmental screenings and access to appropriate follow-up services for children ages 0 to 5 and building ECD expertise into care teams. This funding presents an exciting opportunity to address a key presidential priority to invest in early childhood development and support children's healthy growth. HRSA plans to award a total of $30 million to up to 150 health centers. Applicants may apply for up to $200,000 per year. This period of performance will be 2 years, and the start date for FY23 ECD awards will be September 1st, 2023. You will apply for 2 years of funding. ECD funds will be awarded under a new grant number, H8K. This is separate from your H80 award and will help you document use of ECD funds separately and distinctly from other health center program funds and other federal award funds. You'll use ECD funds to achieve 2 objectives. First, increase the number of children ages 0 to 5 who receive recommended developmental screenings. And second, increase the number of children and their families assisted with accessing appropriate follow-up services within 30 days of a developmental screening identifying an area of concern. You will advance these two objectives by implementing activities in 4 focus areas: workforce recruitment, retention, development, and engagement, access and affordability, patient/caregiver experience, and population health and health-related social needs. This is a competitive notice of funding opportunity. Current Health Center Program Operational Grant, or H80, award recipients are eligible for ECD funding. You'll see in the Notice of Funding Opportunity that the only other criteria for having an eligible application are that you apply for the correct funding amount, which is up to $200,000 per year, upload your project narrative in EHBs, and meet deadline requirements. The ECD application is a 2-phase process. You must first submit in grants.gov and then in EHBs. You must submit the grants.gov application components by March 17th and the EHBs application components by April 18th. These deadlines are listed in the Notice of Funding Opportunity on the ECD Technical Assistance webpage and on a slide later in this presentation. Can we go back 2 slides? And another one, please. Thank you. This slide lists the application components that you'll submit to HRSA in grants.gov and EHBs. For grants.gov, you must complete the SF424 form and a brief project abstract summary. See the ECD Notice of Funding Opportunity for required abstract content. You will also complete several other forms, including the Project Performance Site Locations form, grants.gov lobbying form, and key contacts. Once you submit this information in grants.gov, you'll receive email notification confirming successful submission and will be able to start the application in EHBs. Most application content is submitted in EHBs, so we encourage you to submit in grants.gov as early as possible to maximize the amount of time to complete your application in EHBs. Your EHB submission will include the project narrative, budget presentation, program-specific forms, and attachments. The HRSA SF424 2-tier application guide available on the ECD Technical Assistance webpage and the Notice of Funding Opportunity provide guidance on completing and submitting your ECD application. And EHBs will allow you to reopen your application if you submit it early and realize that you need to make an update before the deadline passes. But you must resubmit the application by the EHB's deadline. Please note that the page limit for your application is set at 60 pages. If your application exceeds this page limit, HRSA will redact pages over the page limit before it moves to objective review. Make sure to check your application carefully before submitting. The main component of the ECD application is the project narrative, which is organized into 6 sections. Each section has corresponding review criteria and assigned points. Need, 20 points, is where you'll describe the need for developmental screening and follow-up services among children ages 0 to 5 in your service area. Response is 25 points total and is where you'll describe your proposed project. The score for response is broken into 2 parts. 10 points for your work plan and 15 points for the activities evaluation. Collaboration, 10 points, is where you'll describe the partnerships that will support your project. If you provide letters of support, they will be assessed as part of this section. Resources and capabilities, 20 points, is where you'll document your health center's qualifications to carry out your proposed project, as well as the resources you will leverage to support project implementation. Evaluative measures, 15 points, is where you'll provide estimated increases in developmental screening and assistance with accessing needed follow-up for your proposed project. And support requested, 10 points, is where your budget presentation will be assessed for consistency and alignment with the proposed plan to meet the ECD objectives. See sections 4 and 5 of the ECD Notice of Funding Opportunity for details. The SF 424A is the standard budget information form. You may request up to $200,000 per year for 2 years. This means that sections A and B should reflect up to $200,000 for year one of ECD funding, and section E should reflect up to $200,000 for year two. Requesting the correct annual funding is an eligibility consideration. So make sure your annual federal request does not exceed $200,000. You must request funding in Section A in the same subprogram proportions as your current H-80 grant. Detail any non-federal funds that will support your ECD project in Section C, also broken down by subprogram. In Section E, include year two funding in the first future year field. Do not write anything in the other columns in Section E. Your ECD application must include a budget narrative that details each federal and non-federal line item cost by object class category for year one and year two. The budget narrative must outline and explain all federal and non-federal expenses that you propose to support your ECD project in both year one and year two. Just like on the budget form, requesting the correct annual funding of $200,000 is an eligibility consideration. For year one, the sum of the costs listed in the object class categories must match Section B of your SF 424A. For year two, indicate any substantive changes from year one. If you will use ECD funds to support personnel, including contracted personnel, your budget narrative must include a personnel justification table that demonstrates alignment with the current salary limitation of $212,100. An example budget narrative on the technical assistance webpage shows how you may list your proposed budget. All proposed costs must support the ECD purpose and objectives. The blue boxes on this slide list ineligible costs. You may not use ECD funding for costs already paid for with H-80 or related supplemental funds, EHRs that are not ONC certified, and facility or land purchases are also unallowable costs. ECD funds cannot be used to purchase and or install trailers and prefabricated modular units, but mobile units and vehicles to transport patients are allowable. Costs for minor alterations and renovations are not allowed, nor are costs for construction. I'm going to now turn it over to Emily.
Thank you, Yeti. This slide lists the program-specific forms and attachments that you will submit in EHBs. Some are required for all applicants, while others are required only if applicable to your proposed project. All of the forms are completed directly in EHBs, while attachments are files that you must upload to your application in EHBs. We've already described the standard budget request form. You will also complete a project overview form and a staffing impact form, which I'll discuss in more detail shortly. You will only complete the equipment list form if you propose to use ECD funding to purchase equipment. You may request to use up to $150,000 of your year one funding for purchasing equipment. If you propose to partner with other providers or organizations to implement your ECD project, you will provide letters of support in attachment 1. If you include indirect costs in your ECD budget, upload a copy of your negotiated indirect cost rate agreement in attachment 2. And you can upload other documents as desired in attachment 2 as well. Just know that anything included here other than the indirect cost rate agreement will count against your 60-page limit. The Notice of Funding Opportunity has instructions for completing these application components. The project overview form includes 2 sections, a structured work plan and an ECD expertise question. The work plan is described in section 4 of the Notice of Funding Opportunity. An example work plan is available on the Technical Assistance webpage. Your work plan will outline your proposed 2-year activity plan. Your activities must advance progress on the ECD objectives. Your work plan includes 4 fields: focus area, activity, and time frame for activity completion. The 4 activity focus areas, which you will see on the next slide, are all required and are pre-populated in the form. You must select at least 1 activity area under each focus area. Then you will write in at least 1 activity for each selected activity area. There is no maximum number of activities. In the time frame field, you will indicate if each proposed activity will be completed in year 1 or year 2. If an activity will be ongoing throughout the 2-year period of performance, select ongoing. The information in your work plan should align with the information provided in your other application components. For example, if you have activities related to hiring new positions, those positions should be listed in the budget narrative. This slide lists the 4 required focus areas in blue. They are workforce recruitment, retention, development, and engagement, access and affordability, patient caregiver experience, and population health and health-related social needs. The activity areas that you will select in EHBs are listed under the focus areas. There is 1 required activity area, team-based care coordination, which is under patient caregiver experience. This activity area is required to ensure coordination across multiple providers that assess and support childhood development within health centers and across community settings. You can also write in your own activity areas in EHBs if needed. When planning your ECD project, you must ensure that your health center has the ECD expertise necessary to support increased screening and assistance with accessing needed follow-up services. You will indicate to HRSA that you will have the necessary expertise by selecting that you will do one or both of the following: enhance existing ECD expertise, such as through training current staff and/or hire or contract with new personnel. You will use the staffing impact form to list direct hire personnel and/or contractor FTEs that you will pay with ECD federal funds. Do not include personnel who would not be supported with ECD federal funds. This slide lists the personnel categories you'll find on the staffing impact form. An example form is available on the ECD Technical Assistance webpage. Position descriptions are available in the 2022 UDS manual. Now I will review other considerations related to award factors and scope of project, as well as reporting requirements. The notice of funding opportunity includes a few factors that will be assessed at the time HRSA makes funding decisions. These factors could impact your ability to receive funding. See the notice of funding opportunity for details. If you anticipate that a scope adjustment or change in scope will be necessary to implement your proposed project, you must submit your request outside of the ECD application and obtain approval before implementing a new service delivery method, or site. Keep in mind that screenings fall under Well Child Services on your Form 5A. If you plan to use ECD funds to purchase a mobile unit, you will need to revise your Form 5B to add that mobile unit to scope before deploying it. You will document ECD-specific progress in semi-annual reports that will describe accomplishments and barriers towards implementing your proposed project. Because ECD awards will be separate from the HAD award, you will also be required to submit a non-competing continuation progress report, or NCC report, to access Year 2 H8K funding. Your NCC report will include an updated Year 2 budget and work plan, along with data on the number of children assisted with accessing appropriate follow-up services. You will also report data on the assistance with follow-up measures through a separate report in Year 2. ECD funding may extend beyond the Year 2 period of performance. HRSA will use your performance on the ECD objectives to make future funding decisions. Developmental screening progress will be assessed through a new Uniform Data System, or UDS, measure. The measure will first appear in the 2023 UDS report, and this data will establish your baseline. Your 2024 UDS data will be used to assess your progress. As I just mentioned, HRSA will measure progress on the assisting with follow-up objective using your NCC progress report in Year 1 and a separate report in Year 2. In addition to progress on the 2 ECD measures, future funding is contingent upon congressional appropriation and a decision that continued funding is in the best interest of the federal government. The first part of your application is due in grants.gov by 11:59 p.m. Eastern Time on Friday, March 17th. The second part of your application is due in EHBs by 5 p.m. Eastern Time on Tuesday, April 18th. HRSA expects to announce awards right around the project start date of September 1. Now I will discuss the technical assistance resources that are available to support your application development and submission. We've mentioned the ECD Technical Assistance webpage throughout this presentation. A link is available on the slide. The webpage offers helpful materials that can answer most of your application-related questions. After today's call, use the BIPIC contact form to contact the ECD Technical Assistance team for application questions. Be sure to use early childhood development within the selection options on the BIPIC contact form. You can use the same contact form to reach Health Center program support for EHB system issues. For any grants.gov issues, reach out to the grants.gov contact center. And if you have any questions about federal grant requirements or how to complete your budget components, contact the ECD Grants Management Specialist, Vera Wyndham. This concludes our ECD summary. Now let's turn to your questions. We are joined by Rebecca Levine, a team lead in expansion in the Bureau of Primary Healthcare. We are also joined by Grants Management Specialist from the Office of Federal Assistant Management. To ask your question, type it in the Q&A pod. If we are unable to get to your question today, submit them to the ECD Technical Assistance team using the BIPIC contact form after today's discussion.
Thank you so much, Emily and Yiddy. Thanks everyone for joining. As Emily alluded to, and you can see in the chat, a recording of this presentation along with the slides will be available within about a week, posted to the ECD Technical Assistance webpage. And thank you for your patience while we get that up there within about a week. The first question, I'm going to loop in our MCHB, our colleagues from the Maternal and Child Health Bureau here at HRSA. There are some questions about if there's a specific developmental screening tool that folks should be using or that we might recommend, or if it's really open to the health centers choosing.
Yes, thank you so much, Rebecca. This is Dina Leeser from the Maternal Child Health Bureau. And first, I want to make sure to refer you to the Notice of Funding Opportunity Appendix B, pages 32 to 33, and then the resources that follow that. So there is a continuum of the kinds of things that are important to include in your screening, such as for developmental milestones, for social emotional development, and caregiver depression. And many of those are fully aligned with Bright Futures guidelines, which sets the standards for pediatric care. And so the key thing is that it is not a requirement to use specific one's particular screen for each. However, they should be evidence-based, recommended screens. There are many, there's a continuum of them. There are several resources in the Notice of Funding Opportunity, such as American Academy of Pediatrics policy statements, and ones that link to something called the STAR Center that speak to some of the specific screens. And you can choose what fits best. Some considerations to keep top of mind are some are open source and publicly accessible. Others require fees and how you might integrate them into your broader system. There's also a reference in the NOFO to a comprehensive tool called the Well Visit Planner that includes a continuum of open source screens. So there is quite a bit of flexibility, but the idea is to align with the continuum that is spelled out in the Notice of Funding Opportunity and to align with Bright Futures and AAP recommendations.
Thank you so much, Dina. Can you provide an example of how funds can support workforce retention? So what we're really hoping that you can, what we're expecting you to do is not only to increase developmental screening, to increase assisting with access to follow-up, but you also need to make sure you have the capacity to be able to do those things. While there's no specific hiring requirement or staffing requirement for this funding, we do expect that if you do not have the capacity at the current time, you would either train current personnel to be able to perform those functions or to support the two objectives, or you would be able to contract with someone or hire someone new to be able to sort of fill out your care team to make sure that you can be able to address these two objectives. Can we use existing implemented screenings that we already use? Of course, we definitely welcome you to use existing screenings, existing procedures and processes services that you already have in place, but you need to use ECD funding to expand what you're already doing. So if the current services address, you can currently screen, a given number of patients. The purpose of this funding is to be able to expand on that and to screen more patients and to link more patients to assist more patients with accessing any appropriate follow-up. This one, I'm going to ask our grants management specialist to chime in. Are we required to include generated program income in the budget, or is it fine to just include federal funding alone, totaling up to $200,000?
Hi, program income and non-federal resources is totally up to the grant recipient. So you can either submit your budget just, showing the federal funds, or if you choose to, use non-federal resources or program income, you can do that as well.
Thanks so much, Vera. Will
You're welcome.
Will ECD awards roll into the base grant after 2 years? So as Emily and Yidi mentioned during the presentation, you're going to report on a developmental screening measure that's going to be newly added to the Uniform Data System reports in 2023, and also an assistance with accessing appropriate follow-up services measure. So HRSA is going to determine if you're going to receive ongoing funding based on your progress on these two measures, as well as based on information from your semi-annual progress reports and availability of future funds to support ECD. Now, what's a little bit different about this funding opportunity as opposed to some of the other service expansion awards that you may receive through HRSA is that HRSA is going to collect baseline information on the developmental screening measure through your 2023 UDS report and measure progress from the baseline data through your 2024 UDS report. So HRSA is also going to collect baseline information on the assistance with accessing appropriate follow-up services measure through your non-competing continuation progress report, and then measure progress from the baseline data through your follow-up assist data report. So during the 2 years, the first year you're going to provide that baseline, and then the second year we're going to measure the increases from that baseline that you provided in that first year. And again, just to reiterate, support, if you're currently doing developmental screening or assisting children and families with accessing follow-up, you just need to increase the number of patients who are accessing those services. You don't necessarily need to do something new, but you need to be able to expand what you're currently doing using this funding. If an attachment is not applicable for my project, do I need to submit a non-applicable placeholder attachment in that space in EHBs? You should not need to submit anything in EHBs if the attachments don't apply to you. Those should be if applicable to you. So you should be able to move forward even if you don't submit something because it does not apply to you. Can you review who is eligible to apply for this grant? Sure. Current HRSA funded health centers are eligible to apply for this grant. So any organization organizations that are currently health center operational grant award recipients. So if you do not receive an operational grant award from HRSA, then you are not eligible to apply for this funding. And if you have questions related to your specific organization's eligibility, you can contact us through the BIPIC contact form. There's a link in the chat, and we'll be happy to address that with you one-on-one. Can we use any funding to pay for transportation costs, such as providing gas cards, to help patients access follow-up services? Yes, transportation is considered an enabling service. So you can absolutely, that is one way that you can help patients access appropriate follow-up, is by providing the transportation for them. But the caveat is that the transportation should be to an in-scope service at an in-scope site. So you can't necessarily keep transporting patients to an organization that is not affiliated at all with the health center, or is not in your health center scope. You should be using that transportation to transport to in-scope services at an in-scope site. Can we assist with paying for fees such as purchasing glasses if they do not have any other source of funding? So it's important to keep in mind that whenever you're providing whatever activities or services that you're providing using ECD funds, you need to keep in mind your sliding scale fee. You can't necessarily just provide to patients that don't have insurance, or you're required to follow your Chapter 9 of the compliance manual, your sliding fee discount program, and also your Chapter 16 billing and collections of the health center compliance manual. And then, but regarding glasses specifically, the purpose of the NOFO, the objective of the NOFO, is to support patients with helping them access appropriate follow-up services. So you wouldn't necessarily be able to pay for a patient's treatment plan or pay for the glasses. The point is to assist them with accessing the appropriate follow-up, because the intervention could be, there's a wide variety of interventions that could be necessary following a screening showing a concern. So we want to maintain the focus on the screening and the assisting with accessing the appropriate follow-up. So that's what's really important to keep in mind with this funding. This is a great question that I think our Maternal and Child Health Bureau colleagues will be very pleased to hear. Does a health center currently receiving TPEC funding qualify to apply for this ECD grant? So TPEC is funding available through the Maternal and Child Health Bureau here at HRSA. And if you are a current H80 award recipient and you also receive TPEC funding, yes, you are absolutely welcome to apply for this funding. And we hope that you do so. We hope that everyone who applies is able to do so. So we're always pleased to see our programs coming together. So that's a great question. How is HRSA defining receive assistance within 30 days of a developmental screening, identifying an area of concern? So the key thing that I want to point out regarding that second measure, which is assisting with accessing the appropriate follow-up, is the patient or the family does not actually have to receive the follow-up within 30 days. The key is that they receive the assistance within 30 days. So that means that you are providing, for example, an enabling service, that maybe some case management or some transportation. They don't have to complete the appointment, but the health center needs to take action to assist the patient within 30 days so that they can access the appropriate follow-up. But again, just the assist needs to be done within 30 days. That's assist is a pretty flexible term. It doesn't look one particular way. It really depends on the circumstance. But again, the key is that you are maybe making a connection with the patient to help them with transportation, or you're helping to identify a provider or providing case management services, different types of enabling services that will help them get to the next step that's been identified for them. And the point of that is, so they're not sort of, there's not an identified area of concern and they're just sort of dropped from the radar. We want to make sure that patients are getting the identified follow-up that they need. And the other aspect of that is that not everything is within the health center's control. We want to recognize that any follow-up following a concern from a screening, it may be within the health center. A health center may provide what's needed as a follow-up, but it also may be outside the health center. And so we don't want to create any expectation that you need to be able to help people get an appointment elsewhere, for example, within 30 days, because that's not feasible. We want to make sure that you're providing that assist within 30 days. Let's see. Will the ECD non-competing continuation be combined into or submitted separately from the H80's non-competing continuation? The ECD's non-competing continuation progress report will be separate. I know that sometimes it's a little challenging to keep track of all the different reporting requirements from HRSA, but we do appreciate it that you stick with us. So the NCC for ECD will be submitted separately, will be its own. It's going to be pretty streamlined. It would be separate. It would just be its own non-competing continuation. Which UDS measures was the slide referring to when discussing continuation of funds beyond year 2? So just to reiterate, only the developmental screening measure is going to be measured through UDS. The assistance with accessing appropriate follow-up is going to be measured first in the NCC for the year 1. And then we're going to have a separate report that we're just calling the follow-up assist data report that's going to measure that data piece for year 2. Can 2 health centers submit a joint application? Yes, one application can be submitted for 2 health centers, but you would only be eligible for the $200,000. You wouldn't be able to submit one application and try to request $400,000 through that application per year. What are the 4 activity areas and a focus on one is required? Correct. If it's possible, could we scroll back to the slide with the activity areas? It's a little bit of a ways back. Apologies if you're a little bit nauseous from the scrolling, but. So these are the activity areas defined by focus area. The focus area is in blue, and then the activity areas are in gray. Only one of them is a required focus area, a required activity area, and that's the team-based care coordination activity area under patient caregiver experience. You are required to select at least one activity area per focus area. But that team-based care coordination activity area is the only one that's actually required. Could you please repeat the information about the use of mobile units? Yes. Mobile units are allowed. You can purchase a mobile unit using this funding. I will ask you though, if if you propose to use ECD funds to purchase a mobile unit, you may need to check your Form 5B and see if you need to add a new mobile unit or if it's replacing a current mobile unit. But please review your Form 5B if you plan to use ECD funds to purchase a mobile unit. Is there a target for the number of children served per year per organization? There's no set, there is no set target. We ask you to provide a projection, a projected increase in your project narrative on the number that you anticipate serving through this funding, you know, the number you anticipate increasing by. But we do want you to make, we do want you to increase based on, in consideration of the capacity of your health center, the amount of funds that you'll be getting. So, you know, if you're a large health center and you're getting $200,000, we probably don't, like when we see the number 5, like you're just in, we'll probably be a little bit concerned about that. So it should be reasonable given your health center's size and capacity and the amount of funds that you're being given through this award. Can you please clarify the $200,000? Is it $200,000 per year or $100,000 each year for a total of $200,000 for the both years? That's a really great question, and I know that a lot of folks can get tripped up on that. You may request up to $200,000 for each year. So that's $200,000 for year 1 and $200,000 for year 2. And please make sure that you're careful when you fill out the SF424A form, because you're going to be filling that out for one year at a time. Certain sections are for just year 1, sections A and B, and then section E is going to be only for year 2. So make sure that you're mindful of how to fill out that form. We have an FAQ on our webpage that identifies in which section of the form you need to fill out for year 1 and which you need to fill out for year 2, and to make sure that you don't either split it and request $100,000 in each, or that you don't accidentally request $400,000 at once. Like I said, I refer you to the FAQ on our ECD technical assistance webpage if you have any questions about how to fill out some of your budget information form. Is there an actual work plan template available to use? I only see an example on the ECD technical assistance webpage. So there's no specific template on the webpage. The ECD technical assistance webpage, as you mentioned, does have an example work plan. The work plan is a structured form in the EHB's portion of the application. So the focus areas are going to be pre-populated. The activity areas you're going to select from a list. You're going to write in your own activity, and then you're going to select the time frame. So like I said, you shouldn't need a template to be able to submit, but you should be able to look at the web page for the example, and then look at your NOFO to see the different activity areas that are going to be available, and the focus areas, as well as the time frames. And if you have any specific questions on that, again, you can ask us through the BIPIC contact form. How will you track changes in developmental screening and referrals? What is the baseline? So as I mentioned earlier, we're going to be tracking the baseline for the developmental screening measure through your 2023 UDS report. And then the increase we're going to measure from the difference between your 2024 UDS report from your 2023 UDS report. The assistance with accessing appropriate follow-up, the baseline is going to be established through your first non-competing continuation progress report. And then we're going to measure progress from that baseline by you're going to submit what we're calling a follow-up assist data report. And that the purpose of that report is to show us the increase in that second objective, or that second measure from the baseline data in the NCC. There's a question about changes in scope. You don't need to wait until you've received an award to submit a change in scope request. We actually encourage you to submit them before we've made decisions about awards, so that at the time when you get an award, you'll already be ready to set up to start implementing your award. But any change in scope requests do have to be submitted outside of the application. You can't make any changes in scope or submit any requests through the application itself. If we are planning on contracting with an external child development education agency, does that agency need to be identified before submitting the proposal, or could we identify an external contractor after receiving a notice of award? You are expected in your application to submit letters of support from anyone who you identify will have a significant role in implementing your award. You can also put in your application that you're budgeting for a contract, as long as you think that you'll be able to get that contract. Otherwise, you may be a little difficult afterwards if you budget for that contract and then it doesn't work out. But you don't necessarily have to have the partnership in place, but we do hope that you'll start that process beforehand, so that you're set up and ready to go once you get the award. One slide indicated that the funding needs to be budgeted in the same sub-program proportions as the current H80 grant. Can you explain this further? Sure. For those organizations at our current health center program operational grant award recipients, you receive your H80 grant award through sub-program proportions. There are 4 sub-programs: migrant health centers, public housing primary care, community health centers, and healthcare for the homeless. So in your SF424A, your budget information form, you're going to be requesting that $200,000 broken down by the same sub-program proportions in those 4 sub-programs that you receive your current H80 grant. So if you receive your H80 award, say 50% through community health centers and 50% through migrant health centers, then you're going to request $100,000 through community health centers and $100,000 through migrant health centers. And if you have any questions about that, if you're not sure about your sub-program proportions, you can ask us through the BitBit contact form, and we'll be happy to help you out with that breakdown. It's not going to be determinative. It's not going to make or break your budget, but that is how we expect you to be able to submit your budget. Can we use existing staff that is repurposed to the ECD project? Absolutely. You can expand a staff FTE to be able to cover some of the ECD work. We also encourage you to train staff so that they're better prepared to support this project and maybe in a new way. But we definitely support using existing staff to repurpose. The only thing that you can't do is you can't, sort of double pay them from multiple grants to do the same work. But yeah, you can absolutely repurpose your staff. I think there's a question about what Dina is referring to for resources. For pages 32 and 33, that was referring to the appendix in the NOFO itself. There are some great resources. Appendix B of the NOFO lists what we've referred to as an ECD care continuum. And if you have any more questions about that, again, you can submit a question. We'll be happy to address that. Can the applicant be a partner of the health center program applying to collaborate and support the grant objectives within a health center? The only current health center program award recipients can be applicants and can receive an ECD grant award. If you are an organization that does this type of work, or you think you could be, your expertise and your line of work may be helpful to a health center, I do encourage you to reach out to your local health center and discuss partnership opportunities to support an ECD project. But organizations that are not current health center program operational grant award recipients are not able to apply for or to actually be award recipients. Someone notes that the ECD webpage does not contain a link to the slides. And again, they're going to be posted within about a week. We do not have them posted at this time. Do you expect the pediatrician to do the screening? I'm actually, if it's okay with you, Dina, I'm going to kick this one back over to you.
Sure, that is certainly not required. There is many opportunities for ECD support staff, other parallel staff, for it to happen even pre-visit the actual screening and scoring. So there are many different approaches to who and how and where the actual screening occurs, but it is critical that it is part of the visit and the care itself that the screening gets addressed and any issues discussed and any interventions or supports made.
Thank you so much. There are a lot of questions about the new UDS measure that's going to be in the 2023 UDS. It's going to be available in the 2023 UDS manual, which is not currently available yet, but we will make sure that that is available to you as soon as possible. But that information of the exact measure is actually not available yet. So I know that's a little bit challenging, but we will get that. That should be ready not too long. How are we defining expansion? Is there a specific % increase or service area number we need to meet? And again, increase, there's no defined increase requirement. We want to take into consideration your health center's capacity, the amount of funds that you're going to get, and then the plan and the activities that you're going to be performing. So it's really specific to your health center and the program that you're going to be able to build, and what you're doing already, and if you're really starting from ground zero. So it's pretty specific to your health center. And if you're going to serve 1,000 new patients versus just supporting it like 100 new patients, that doesn't necessarily mean that you're going to score lower on your application if you propose a lower increase. Again, it really depends on your health center's capacity and the activities that you anticipate performing and the program that you want to build. Because if you're a smaller health center, the expectations are going to be different than if you're a very large health center with more resources. Can we use funds to support upgrading our EHR, our electronic health records? Absolutely. Maybe you need to, we really encourage you to support care coordination through this funding. That's one of the reasons that team-based care coordination is a required activity area. We want you to be able to make any upgrades to your EHR that you need to meet the needs, especially because we're implementing new UDS measures that are coming up, and we want to make sure that you're able to account for all of those changes. It was mentioned before that we should apply for the correct funding amount. Is that based on the number of patients? How is that assessed? The correct funding amount is up to $200,000. And so you can request up to $200,000, and anything above that is going to be problematic, but you are welcome to request up to $200,000 from your health center. If we offer the transportation service on our own van, is the gas and repairs and transportation personnel salary eligible? You can support a driver for your transportation. I'm actually gonna see if Vera, if you have any input on that, gas and repairs for their own van for transportation.
Hi there, this is
yeah.
Sarah. Oh, go ahead,
Sarah.
Vera.
I was gonna say, yes, if you're using the van to support the scope of the, of the grant, yes, that will be an allowable cost. You can, if you're wanting to pay, they're wanting to pay like the driver of the van. Is that correct?
Yeah, the driver, and also for some of the expenses of the van,
Yes,
gas,
yeah.
maintenance.
Yes, they are, that will be an allowable expense under the other category for gas and, the maintenance and upkeep of the van, as long as the van is being, used to serve the purposes of the, of the grant. And the driver will be paid as a contractor, or, just, yeah, if they're just hiring the driver just to drive the van. So he could be hired as a contractor as well to support the needs of the grant.
Thank you so much. Well, it looks like we are out of time. I apologize if we did not get to your questions today. Please make sure to submit them through the BIPIC contact form so that we can address them for you and make sure that we can adequately support you to apply for this funding. And I will turn it back over to Emily and Yiddy.
Awesome. Thank you so much, Rebecca. That was a great Q&A session. So thank you all for your questions. And now we have some poll questions. We appreciate your opinion on today's session, which helps us to improve the technical assistance that we provide. And we'll offer you a few moments to respond to the poll questions. Thank you for joining us today. HRSA encourages every eligible health center to apply for ECD funding to expand developmental screening and assistance with accessing appropriate follow-up. Have a great day.